Hey, this is Dr. Mila McManus. I'm going to talk to you guys about different ways to do testosterone replacement. There are lots of different methods out there, and here's what we like to do. So, the most common way to give testosterone is by an intramuscular injection, which is usually in the thigh muscle or the buttock area. And once a week is a good compromise, but actually doing a lower dose twice a week is better to get a more even level of testosterone. You certainly don't want to be getting an injection every 2, 3, even 4 weeks. Then you're just going to get a massive level when you do that injection, and you might actually feel superhuman, or you might be really irritable and have more side effects like acne. And then your level's just going to slowly come down over those 2, 3, 4 weeks. And towards the tail end of that, you're going to not feel so hot. So getting your injections more frequently is a good idea. Another thing to consider is how you inject it. So while traditionally it's done intramuscularly, we like to use it subcutaneously, which means you inject it using tiny little insulin syringes into the fatty tissue of your abdomen and doing low dose twice a week. And the benefit of doing it that way over intramuscular is that it's an easier way to inject, in my opinion, but also studies have shown that it reduces the aromatization, or rather the conversion of testosterone into excess estrogen in the body. So good ideas there for injections. Other ways to get testosterone is through pellet therapy. Pellet therapy is where the pellets can range in size from like a grain of rice to about the size of a Tic Tac. And for men, they're typically injected about every 4 months. Women usually get them about every 3 months. Now, while this may be bioidentical type of testosterone, it's a super therapeutic dose, we call it. So we're not staying in a physiologic range, meaning of what your body should be producing anyway. You're getting a quite higher dose, which is why most people love pellet therapy. And I've tried it myself, and it's night and day. You just don't even know there's another level of how you can feel until you see that level. So another thing is you can get compounded testosterone into sublingual liquids, sublingual tablets, troches, which are like little lozenges that just dissolve in your gum area right here. You can also have testosterone compounded into capsule form, and I typically would rather do injectables or cream form. So you can do testosterone in cream form that you can do vaginally for women or topically for men, and various areas that we direct you to. So I think that covers most of them anyway. So be sure and talk to your provider about all these different ways to do testosterone and what's right for you.